So there's quite a change now for general practitioners because they will no longer be preparing a slide, and the new actual platform or sample is a liquid-based sample, and many GPs will be familiar with this vial. It's known as liquid-based or sample or a thin prep vial, and the cervical sample will actually be placed into the vial. So a couple of tips are that GPs should always check the expiry date on the vial. After they remove the plastic wrap on the vial, it's important to note the two black dots on the cap and the body of the vial, which we'll refer to in a moment. We also suggest that GPs have one of these vial holders handy. It certainly prevents the sample from spilling or tipping. It's fine to actually open the vial just before you're about to take the sample, and then you will be using a range of instruments to take the sample. Most GPs are using a plastic speculum. The important difference for the renewed program is that lubricant can certainly interfere with the quality of the sample, and so the preferred method of lubricating the speculum would be to run it under warm water. However, if you would like to use lubricant, you should be using a water-soluble, carbomer-free lubricant. And when you do use it, it really needs to be applied very sparingly and judiciously to the sides of the speculum, avoiding the tip completely. So one of the important points for GPs to remember is that we still in the new program want you to visualise the cervix and collect a sample, preferably from the transformation zone. And you'll be using a selection of plastic instruments to do that. When collecting the sample from the cervix and using the cervix broom, the main point is to remember to be well applied to the ectocervix as you rotate the brush 3 to 5 times. The next important area is transferring the cell sample into the actual vial. And GPs may take a bit of a shortcut here, we're all busy, but you need to spend ample time releasing the cells from the brush into the vial. And we need at least 5,000 cells in the vial to be able to read the reflex cytology, should that be necessary. So the recommendation is to really push and rotate into the sides and the bottom of the vial at least 10 times. And remember, at the end, to discard the sampling device. It shouldn't be left in the thin prep medium. Once you have collected your sample, please ensure that you actually shut the vial so that the black dot on the body of the vial and the cap of the vial actually either meet or cross, and that's to actually prevent leakage of the sample during transport. Now, ideally your laboratory will actually provide you with a smaller size specimen bag with an absorbent pad, and the vial should actually be placed in there, and of course you have labelled it with, we actually need 3 identifiers: surname, first name or given name and date of birth. And then the smaller sample bag would go into the larger specimen bag, and you would place your request form as usual in the front pocket, and this is now ready for transport to the laboratory either via courier or through the mail if that's what you're using.